Greetings, my amazing buddies. I hope today is going well for you. Let me begin with this crucial fact. Your basis is your legs. Leg weakness is a major health risk as we age, particularly after the age of 60. Your confidence, movement, balance, and, regrettably, even your freedom are all impacted. Here's the good news though. To maintain those legs strong, lively, and pain-free, your body urgently requires certain vitamins and natural nutrients. Therefore, regardless if you're 70, 80, or 90 years old, I want to share with you today 3 potent vitamins that will help you quickly strengthen your legs. Now, let's get started. Today I want to discuss vitamin D3, which is a really basic yet frequently disregarded topic. When it comes to your leg strength, balance, and even your ability to walk with confidence as you age, this tiny vitamin can have a significant impact on your health. I am aware that many of you are coping with joint stiffness, weariness, cramps, and weak legs. Without utilizing your arms for support, you may even find it difficult to get out of a chair or move upstairs. One of the first things I advise my patients and acquaintances to check is their vitamin D levels, since these are indicators that your body is communicating with you. When your skin is exposed to sunlight, your body actually creates vitamin D3, sometimes referred to as the sunshine vitamin. Here's the issue though. The majority of adults over 60 do not get nearly enough of it. You see, as we age, our skin's ability to synthesize vitamin D from sunlight decreases, and many seniors either don't spend enough time outside or, if they do, they frequently wear sunscreen, wide-brimmed hats, or long sleeves, all of which prevent the formation of D3. Living in places with little sun exposure, overcast days, and pollution make it quite simple to become deficient without even realizing it. Now, why is this so important to your legs? Because bone density, nerve transmission, and muscle strength, all of which make you strong, steady, and balanced, all depend critically on vitamin D3. Your bones begin to deteriorate if your body is unable to adequately absorb calcium from your diet or supplements due to insufficient vitamin D3. That's not all though. Additionally, your muscles lose their effectiveness. You might find that your legs are weaker or that they fatigue easily. You might even have a wobbly, unsteady feeling, particularly when standing or walking for extended periods of time. Numerous research conducted over the years have demonstrated a clear link between low vitamin D levels and muscle weakness, particularly in the legs. According to one study, seniors with low D levels were more likely to fall and had noticeably weaker lower limbs. One of the most dangerous things that can happen to us as we age is a fall. Long hospital stays, shattered hips, and even irreversible loss of independence are possible outcomes. Now, pay close attention. This is preventable and it's not difficult. Your body starts to repair itself when it has adequate vitamin D3. You feel more stable, stronger, and more energized. Your bones remain strong and dense, your muscles contract more effectively, and your nerves fire more effectively. Your legs will start to feel stronger, your posture will get better, and you'll move with greater confidence if you're consistent. This doesn't happen overnight. Before we start today, kindly let me know where you're coming from. Feel free to leave a comment below and ask any questions you may have. Click the subscribe button and turn on notifications as well, so you don't miss any of Senior Health Tips' best health tips. And if you're watching now, I want to know if you're with me. Type 1 in the comments section if you find this video to be meaningful. Type 0 otherwise. How can we increase our intake of vitamin D3? Sunlight is the most natural method. If at all feasible, I usually advise my friends to get at least 15 to 30 minutes of sun exposure each day. Ideally in the morning when the sun is not as powerful. For a little while, expose your face, arms, and legs to the sun without wearing sunscreen. Both burning and going overboard are not necessary. A small amount each day can make a big difference. However, supplementing is the greatest option if you reside in an area with little sunshine or are unable to get outside. I advise taking 2,000 to 5,000 IU of vitamin D3 per day for the majority of persons over 60. The form that your body normally makes in reaction to sunshine is D3, which is also the most active and absorbable. Avoiding vitamin D2 is crucial because it is less efficient and does not increase blood levels as much. Another thing that many people overlook is this. Make sure you're getting vitamin K2 if you're taking calcium and vitamin D together. Why? Vitamin K2 ensures that calcium is delivered to the proper locations, your bones and teeth, not your arteries or soft tissues. Because vitamin D aids in the body's absorption of calcium. In the absence of K2, calcium may accumulate in undesirable locations, raising the risk of kidney stones or vascular stiffness. A D3-K2 combo vitamin is what I always suggest. They complement each other well to protect your heart and build stronger bones and muscles. It's also critical to have your levels assessed. You may find out exactly where you stand with a straightforward blood test called 25-hydroxyvitamin D. Most folks find that 50 to 80 ng/SOS/ml is the ideal range. You're likely lacking if you're under 30, and you must act immediately if you're in your teens or single digits. To be clear, vitamin D3 is not a miracle drug. It's a foundational nutrient, but it won't solve everything by itself. Rebuilding the health of your bones, legs, and complete body is one of the first steps. It's a steep slope to climb without it. By using it, you're providing your body with the natural resources it needs to recover and flourish. I will say this from the bottom of my heart: don't wait. Take your vitamin D3 carefully if you have weak legs, are always exhausted, or are afraid of falling or losing your equilibrium. Take a high-quality supplement. Get some sunshine. Take it with vitamin K2, and most importantly, be consistent every day. Keep in mind that your body is incredibly capable of healing itself. No matter your age, you are made to move, to be strong, and to live on your own. You'll be astounded at how your body reacts if you give it the resources it needs. I want to talk honestly about a topic that affects millions of individuals, particularly those who are in their 60s, 70s, and older. The sensations in your legs or feet could be scorching, tingling, numbness, or an odd feeling. Even when performing the most basic duties, you may feel weak, shaky, or fatigued, or it may feel like you're walking on pins and needles. If that describes you, pay close attention because what I'm going to tell you could completely alter your life. Most elderly people are lacking in a vital vitamin, which is one of the primary causes of chronic weariness, limb weakness, and poor neurological health. It's vitamin B12. Cobalamin, another name for vitamin B12, is one of the most vital nutrients for your muscles, nervous system, and energy metabolism. It provides support for your spine, brain, and the lengthy nerves that extend down to your feet. Symptoms including numbness, tingling, burning, and balance issues appear when the nerves in your body malfunction due to a lack of vitamin B12. You see, vitamin B12 aids in the development of the protective layer that surrounds your nerves, known as the myelin sheath. Consider it analogous to the rubber covering that surrounds electrical cables. The wires would short circuit without that shielding. Within your body, the similar thing takes place. Signals from your brain to your legs are interfered with, and your nerves start to malfunction. Because of this, persons who have low B12 frequently feel unsteady, awkward, or as though their legs aren't reacting correctly. However, it doesn't end there. Additionally, red blood cell production and the conversion of food into energy depend on vitamin B12. You feel exhausted all over when your B12 levels are low, not just weak in the legs. You may experience mood fluctuations, despair, shortness of breath, or even a hazy brain. Here's what you should actually pay attention to. Our body's capacity to absorb vitamin B12 declines significantly with age. You are not to blame for this. It's a natural aspect of growing older. The production of stomach acid, which is necessary to release vitamin B12 from our diet, decreases with age. Your absorption may be significantly worse if you have had stomach surgery or are using acid blockers for heartburn. Millions of elderly persons, including those who consume meat and dairy products, are living with an untreated B12 insufficiency because of this. The frightening thing comes next. A B12 shortage may resemble other severe illnesses. It may appear as multiple sclerosis, dementia, neuropathy, or even persistent weariness. Because of this, the harm frequently stays unrecognized for years. Here's the good news though. If you catch it early and take the appropriate action, it is easily reversible. What therefore ought one to do? First, have your vitamin B12 levels examined if you're suffering tingling, foot pain, numbness, or weakness in your legs. The hitch is that it's a straightforward blood test. Labs frequently utilize a reference range that is overly wide. If your B12 levels are above 200 pg cell L, many doctors will claim you're normal. However, in order to properly sustain nerve function, your levels should be closer to 600 to 900 pg cell L. Therefore, constantly strive for the ideal range rather than just the typical one. Let's now discuss ways to increase your body's intake of blood, B12. Foods derived from animals, such as dairy, fish, poultry, eggs, and red meat, are the finest natural sources. But once more, as we become older, we absorb less from meals. For this reason, supplementation is frequently required. Using a sublingual methylcobalamin version of vitamin B12 is something I strongly advise. This is the active version that enters the bloodstream directly through the tongue, avoiding the gut entirely. A dose of 1,000 micrograms per day is safe and effective for the majority of elderly people. Your doctor can suggest B12 injections if your insufficiency is severe in order to speed up the restoration of your levels. Furthermore, it's never too late to get started. Just fixing their B12 deficiency has helped folks in their 80s and 90s regain their vitality, balance, and lessen leg pain. It only requires dedication and consistency. It doesn't take a lifetime. I should also mention that vegans and vegetarians are far more likely to suffer from a B12 shortage. Since B12 is not found in plant foods, if you are over 60 and on a plant-based diet, you must take supplements. Additionally, several drugs, particularly proton pump inhibitors for acid reflux and metformin for diabetes, might affect the absorption of vitamin B12. You must exercise considerably greater caution if you are on any of these. Here's what I advise my patients, family, and viewers. Check your B12 if your legs don't feel comfortable. If you're always exhausted, look at your B12. Check your B12 if you feel lightheaded or unsteady. It's an easy action that can prevent falls, years of agony, or worse. It is not your purpose to live in constant fear of falling. Walking around with pins and needles in your feet is not what you were intended to do. Furthermore, you are not supposed to be always worn out. Your body is trying to cure itself. It seeks to restore your strength, calm your anxiety, and restore your self-assurance so you may move freely once more. However, you must provide it with the proper resources. One of the tools is vitamin B12. Therefore, please heed this advice. Begin now. Verify your levels. You may assist your nervous system walk stronger, stand higher, and feel more invigorated by incorporating a high-quality B12 supplement into your daily regimen. On this journey, you are not traveling alone. I have faith in your ability to make a natural adjustment in your health. I have a really basic question for you now. Are you prone to nighttime leg cramps? Have you ever been awakened from sleep by a tight tugging sensation in your calves or feet? Or perhaps it occurs during the day when you're sitting or walking, and your legs suddenly feel heavy and exhausted, or merely spasm. You're not the only one if that sounds similar. Millions of people struggle to move freely or sleep soundly due to circulation problems, leg cramps, and restless legs, particularly in those over 60. Here's the good news though. A natural mineral that is easy to use, safe, and frequently disregarded can help lessen or even completely eradicate these symptoms. We call it magnesium. I understand that magnesium might not sound particularly thrilling. It's not in style. The headlines don't give it much attention. Let me tell you something though. It is one of the most important nutrients for blood flow, neuron health, and muscular function, particularly in the legs. The body uses magnesium in more than 300 metabolic processes. It is essential to the contraction and relaxation of your muscles, the firing of your neurons, the beating of your heart, and the flow of blood throughout your body. These systems begin to malfunction when magnesium levels are low. This is what occurs now. A magnesium deficiency impairs the ability of your muscles to relax. They begin to stiffen. In addition to cramps and spasms, you may have uncomfortable feelings like twitching, leaping, or restless leg syndrome. Furthermore, low magnesium has an impact on your neurological system, which can cause jitters, anxiety, and perhaps even trouble sleeping. Despite feeling tired, tight, and hurting, many persons with magnesium insufficiency are unable to find relief, and the majority of people are unaware of this. Additionally, magnesium promotes better blood circulation, particularly to the lower limbs like the legs and feet. The soreness, stiffness, and heaviness start when your blood flow isn't optimal because your muscles aren't getting enough oxygen and nutrients. Magnesium may be the missing component if you've been wondering why my legs hurt or cramp all the time. Let's now discuss the facts. Most people don't get enough magnesium, especially older folks. Why? There are several important causes. First, foods high in magnesium are scarce in contemporary diets. Minerals are removed from packaged and processed foods. Because the soil in which they are grown has been depleted, even the fruits and vegetables we consume now have lower magnesium contents than they had in the past. Second, over time, magnesium levels may be depleted by several drugs, including diuretics, water tablets, acid blockers, and even some antibiotics. You might not even be aware that your levels are dangerously low if you've been taking any of these drugs for years. Third, your body rapidly burns through magnesium when you're under emotional and physical stress. Whether it's worry, insomnia, chronic pain, or just the challenges of age, the majority of us experience stress on a daily basis. What do you do then? How can this be fixed? First, I want you to start eating more foods that are high in magnesium. Black beans, avocados, bananas, almonds, spinach, pumpkin seeds, and dark chocolate in moderation are a few of my favorite foods. In addition to providing magnesium, these meals are rich in potassium, fiber, and other minerals that promote healthy muscles and circulation. To be honest though, food is frequently insufficient on its own, particularly if your levels are already low. Supplements containing magnesium can help with that. To be clear, not all kinds of magnesium are absorbed similarly, even if there are several varieties available on the market. Some are good for the health of muscles and nerves, while others are healthier for the brain and gut. I suggest magnesium citrate or magnesium glycinate for nerve pain, leg cramps, and spasms. These types tend to be mild on the stomach and are very absorbable. Depending on how your body reacts, you can gradually increase the dosage from 200 to 400 mg each day. Just to be cautious, always ask your doctor if you are on any drugs. Additionally, there are topical magnesium options such as Epsom salt baths or magnesium oil. If you suffer tightness or soreness in certain areas of your muscles, these are great. Simply rub the oil onto your legs right before bed, or spend 20 to 30 minutes soaking in a warm bath with Epsom salts. It is highly therapeutic, cleansing, and calming. After taking supplements, some people now report feeling better in a matter of days. It could take a few weeks for others. However, consistency is crucial. Don't try it once and then put it out of your mind. As with drinking water or brushing your teeth, incorporate magnesium into your everyday regimen. Remember that staying hydrated is also important. Magnesium maintains healthy muscle function by interacting with electrolytes such as potassium and sodium. Therefore, stay away from excessive caffeine and alcohol, which can dry the body and accelerate the depletion of minerals, and drink lots of water. I want you to consider this, friends. You don't need to endure suffering. Leg cramps that prevent you from getting enough sleep are not something you have to endure. You don't need to sit there terrified that your legs may fail you. Your body will want to relax if it wishes to heal. It longs to move smoothly once more. And that healing can be unlocked with something as basic as magnesium. This is something I've seen repeatedly. When their magnesium shortage was fixed, patients who had been dealing with chronic pain and poor circulation for years finally found relief. The cramps in my legs stopped. It became less painful. The quality of the sleep improved. Above all, they experienced optimism once more. Therefore, please don't undervalue this mineral's strength. It's not a trend. This isn't hype. It's necessary. Begin now. Increase the amount of foods high in magnesium in your diet. Think of a premium supplement. Take an Epsom salt bath or use magnesium oil. Pay attention to your body and provide it with the nourishment and attention it has been longing for. You are worthy of a pain-free life. You are worthy of walking fearlessly. And at whatever age, you deserve to feel powerful, at ease, and vibrant. I wish today brings you strength, serenity, and blessings. It's time to discuss something very significant. Millions of senior citizens are impacted by this every day. Frequently, without even realizing it, you, a loved one, or someone you care about greatly may be affected by this. I want you to pay close attention if you're over 60. Because what I'm going to tell you could change your life in terms of your health, your legs, your balance, and your capacity to age independently. In actuality, elderly frequently suffer from dietary deficiencies, especially those related to the vitamins we've been talking about: magnesium, vitamin B12, and vitamin D3. Your energy levels, bone health, muscular coordination, nerve function, and leg strength are all significantly impacted by these three nutrients. Even still, most seniors today are lacking in one or more of these areas without even realizing it. You may be asking yourself, how is it possible? I take care of myself. I try to be active, I eat healthily, and I believe you. However, the body evolves with time. In your 60s, 70s, or 80s, what worked for you in your 30s and 40s doesn't work the same way. It's just biology. Let me clarify. Our body's ability to absorb certain nutrients decreases with age. Even if you're consuming the correct meals, you may not be absorbing the vitamins and minerals as well as you once did. Your liver processes things differently, your stomach generates less acid, and your digestive tract slows down. One of the primary causes of elderly persons developing deficiencies without even recognizing it is this. For illustration, let's look at vitamin B12. Your stomach must produce intrinsic factor and enough stomach acid to remove the B12 from proteins in order for you to absorb B12 from food. However, even if they consume meat, dairy, or eggs, many people stop making enough stomach acid after the age of 60, which means they aren't getting the B12 they need. Fatigue, nerve damage, leg numbness, and even balance issues are the outcome, all because aging has altered the body's capacity to absorb B12. Let's now discuss vitamin D3, sometimes known as the sunshine vitamin. Sunlight exposure causes your skin to produce D3, but after the age of 60, your skin's ability to convert sunlight into usable vitamin D declines. Additionally, many seniors are not making nearly enough of this important vitamin because they wear sunscreen, cover their skin with clothing, or spend less time outside. This is where the issue lies. A low D3 significantly raises your risk of falls and fractures since it indicates weakened bones, muscles, and balance. The soothing mineral magnesium is another. It has a role in blood pressure regulation, neuron function, and muscular contraction. However, among older adults, it is one of the most frequently lacking minerals. Why? Because magnesium is depleted from the body by a number of drugs, including diuretics, acid blockers, and some antibiotics. Not to mention that processed foods, stress, and poor digestion can deprive the body of magnesium. Therefore, you can be running low without realizing it, even if you're making an effort to eat healthily. Here's the terrifying part. Frequently, these deficits don't manifest symptoms immediately. They take time to grow. You may have mild fatigue, stiffness, leg pain, or unsteadiness. The majority of individuals attribute it to just growing older. They are unaware, however, that these modest indicators are early warnings. Ignoring them can also result in major issues including depression, memory loss, falls, fractures, and neuropathy. Don't wait till something breaks. I always advise my patients. Now, begin to support your body. By addressing these common vitamin deficiencies, you can avoid a great deal of discomfort, weakness, and suffering. The good news is here. It's not difficult. Expensive medications and difficult procedures are not necessary. Giving your body what it lacks can sometimes be the answer. Allow me to tell you a little tale. An 82-year-old patient of mine complained of excruciating cramps at night and persistent limb weakness. She had to sit down in order to cross the kitchen. Her physician advised her to embrace the fact that it was simply old age. However, I was aware. She had low levels of magnesium, vitamin B12, and vitamin D. According to our testing, we also added magnesium glycinate before bed, methylcobalamin B12 under the tongue, and a daily D3K2 pill. Her cramps were nearly gone in 3 weeks. After 6 weeks, she was able to walk on her own. She was sleeping through the night and performing stretches by the time she was 2 months old. "I feel like I got 10 years of my life back," she said to me, Dr. Mandell. That's how focused nutrition works. I want you to fully get this, my friends. You don't have to suffer because you're getting older. Something is not always normal just because it is common. At any age, you should feel powerful, stable, and invigorated. Additionally, it's time to change the way you think about your body if you're over 60. You must take the initiative. Because your body is always changing and your diet must adapt to those changes, you need to plan ahead. What are you able to do then? First, discuss getting your levels evaluated, particularly for magnesium, vitamin B12, and vitamin D with your healthcare physician. You may learn a lot from a basic blood test. Second, emphasize entire foods such as fish, eggs, leafy greens, nuts, seeds, and fermented dairy. Limit processed and sugary snacks that deplete your body of minerals. Third, think about taking high-quality supplements, particularly if you have leg pain, cramps, exhaustion, or trouble balancing. They're not tricks. Regardless of your age, they are tools to help your body recover itself naturally. Finally, maintain consistency. Although healing takes time, your body will react if you have patience. I've witnessed it countless times, and I think it's possible for you as well. Weakness is not something you have to accept. You don't have to accept suffering. You possess the ability to regain your original strength. I hope today is inspiring, safe, and tranquil for you. We should have a heart-to-heart discussion. I want to address those of you who might be feeling disheartened directly. Perhaps your legs have been feeble. Perhaps you simply don't have the same level of balance as before. Your legs may feel unsteady, so you have ceased climbing stairs or walking long distances. Or perhaps you have experienced a fall or have been so afraid of falling that you have completely stopped moving. With all the love I have in my heart, let me be clear. You are not stuck. You're not damaged. Additionally, you can always start feeling better at any age. A major medical operation might not be necessary for you. You might not require a miraculous medication. Minor daily routines and regular minor activities can often be all you need to re-energize your body, regain your strength, and eventually regain your independence. After working with seniors like you for decades, I've come to the conclusion that this is normal for your age and that you should slow down, or just accept it. I've witnessed what occurs when you reject that story and make small, deliberate progress toward recovery every day. The smallest details have the greatest impact. Let me tell you why. Your body is a live, thinking organism. Its systems are always changing, adapting, and reacting to your treatment. You women are literally saying, your body, I'm ready to heal, each time you provide it with the proper nutrients, movements, sleep, and attitude. Let's start by discussing your dietary basis before moving on to those minor everyday routines. I've already discussed magnesium, vitamin B12, and vitamin D3. These minerals are essential for good health. They are essential, particularly for your bones, muscles, and nerves. When you take these vitamins regularly, your body not only functions better, but thrives. Imagine what happens when you give your cells what they haven't had for years over the span of 30, 60, or 90 days. Your muscles start to contract once more. Your legs' nerves can communicate more effectively. You get better posture, your vitality rises. On your feet, you feel lighter, more liberated, and more assured. However, consistency is crucial in this situation, sister. It is insufficient to take your supplements for just one day, 1 week, or even 2 weeks. You won't get strong overnight, just as you didn't get weak overnight. Your strength is rebuilt from the inside out by the deliberate actions you take each and every day. Take this first. Eat breakfast before taking your D3. Every day, put your B12 under your tongue. Just a few seconds are needed. To promote sleep and calm your muscles, take your magnesium before bed. Easy, isn't it? But strong. See how your legs start to change by doing this every day. Since your body was designed to move, regardless of your age or health, let's now discuss mobility. Running a marathon is not required of you. Going to the gym is not necessary. Your legs will appreciate it if you move gently and steadily to activate your muscles and increase blood flow. Take 5 minutes each day to begin. Take a stroll around your house. There is a march. Grasp the kitchen counter and stretch your thighs and calves. Raise your heels. Gently bend your knees. Even standing up and down from a chair several times a day is a great way to gain muscle. Take a stroll outside and enjoy the fresh air if you're feeling more mobile. Move your body while walking gently and securely, as each stride communicates to your brain that you are more alive. I spend more time sitting and healing. I sat with greater strength. Additionally, your circulation gets better as your legs move. You improve your equilibrium. Your attitude improves, and you gradually experience greater freedom and less dread. Hydration is another tiny habit that has a big impact. Dehydration causes muscle cramps, exhaustion, and impaired circulation, particularly in the legs, yet many seniors don't drink enough water. Give your muscles what they require because they are composed of 75% water. Drink water all day long. If necessary, add a pinch of sea salt to aid in mineral retention. Steer clear of sugary beverages and excessive coffee as they deprive your body of minerals and water. Rest, my friends, is not a sign of laziness. It is not a waste of time to sleep. This is the period of time when your body heals, grows new tissue, and regains its functionality. Get into bed sooner. An hour before going to bed, turn off the phone and television. Get your magnesium. Take a deep breath. Just as much as you need food, you also need sleep. I want to talk about something else now that is very important. Your attitude. Your ideas are strong. Your reality is shaped by your beliefs about your body. Your body will believe you if you declare, "I'm old and weak." Your cells will shut down if you say, "I'm too far gone." However, your body will rise to meet that conviction if you begin telling yourself, "I'm getting stronger every day. I'm healing, I'm improving, I can do this." Exercise and vitamins aren't the only things involved. It's about believing that you deserve recovery and allowing yourself to change, since you are. You have a choice every day. You have two options. Concentrate on what you can rebuild or on what you've lost. You may either show up or give up. Daily practice of little habits leads to significant change. The person who stretches for 5 minutes every day is the one who gets their flexibility back. By the end of the month, the individual who takes their vitamins every morning feels stronger. The individual who consistently walks to the mailbox maintains their independence. Regardless of age, the individual who perseveres is the one who achieves success. You can be that person. I'm here to tell you. You are already. I can know you're ready since you're listening to me right now. Let this serve as a reminder for you today. You underestimate your strength. Contrary to what you've been told, your body is more resilient. Before we start today, kindly let me know where you're coming from. Feel free to leave a comment below and ask any questions you may have. Click the subscribe button and turn on notifications as well, so you don't miss any of Senior Health Tips' best health tips. And if you're watching now, I want to know if you're with me. Type 1 in the comments section if you find this video to be meaningful. Type 0 otherwise. You still have a lot of life to live. Making the choice to begin is all that is required. One stretch, one vitamin, one glass of water, one step, and one positive thought. You'll be astounded to see how your legs, strength, and independence start to return if you do that every day.